Talked about the White House missing that goal by July 4th, vaccinating 70% of all adults with at least one shot. Here now to join us is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. And Doctor, you know what the numbers are right now. Here in Massachusetts, we've hit the goal. The country is not going to hit the goal. I know you want us to ask you, what's your message to everybody out there? And it's been the same message that we've been asking you really for the whole time. But why isn't it getting through, do you think?
Okay, so Maria, first of all, we're close to the goal. In fact, the good news is that 70% of adults 30 years and older have been vaccinated. So we've reached that target. And in fact, 87% of those 65 and older, that real high-risk group, have received at least their first dose. 77% are fully vaccinated. That's more good news. All right, now the not so good news. Those under 30, between 12 and 30, we're missing that mark right now. And there are three reasons why we want them to get vaccinated. The first one is they can be a vector to transmit the virus to others, okay? So that's very important. The second, of course, is that we want to be able to protect those kids that are under 12 that can't be vaccinated yet because it's not approved. Right. So if we get more of those older kids vaccinated, for instance, at camp, then less likely that they'll spread it to the under 12 years. And then lastly, kids can get really sick from this. Even though most do well, that mysterious inflammatory syndrome, we want to prevent that. And remember, the Delta variant is exploiting those kids and adults that are unvaccinated. So yet another reason why we want to make sure that more of us get vaccinated.
Dr. T, we're learning more about the impact of COVID, even in mild cases. One study suggests that the virus may damage the brain. What do you know about that? What can you share about that?
First of all, the key word is may. This is a study from the UK that looked at MRIs, brain imaging, before and after COVID patients, and then in a group that didn't get COVID. And what they showed is in some of these people who had loss of smell and taste, they had some changes in parts of their brain. I think what's important to note is that there are two groups of people that lose their sense of smell and taste after COVID. One gets better about 2 or 3 weeks later. The other can have much more prolonged loss of smell and taste. Based on this study, what's still not clear is it really infecting the brain, or is it affecting the nerves that basically innervate the smell and taste, and then the brain is secondarily changing. And remember, this has not been peer-reviewed yet. Right. Again, I think the take-home message here is get vaccinated, don't get COVID, and you won't have to worry about losing your smell or taste.
And really quickly, do we even know if these neurological symptoms eventually go away, or are these people losing their taste and smell permanently?
So most people recover their sense of smell and taste after about 6 months, but there's still about 5% of patients where we really can't say they still have prolonged loss of smell and taste, and we're not yet sure whether it will be permanent or not. But for most people, you do recover, but it can be really rough.
Dr. T, thank you for your time. We're going to use you in the transition here. Where you are, is it raining?
It is raining, yes. I'm glad that the Sox are playing not at home.
Yeah, not at home. That's good. Well, very good. Okay, so it's raining where he is. It's raining virtually everywhere.
It is.